Menopause, okay, around this age, 45 to 55. On average, it is like 50 years old. Ovary becomes unresponsive to FSH and LH. That's why they will stop ovulation. So early symptom of menopause is that irregular menstrual cycle. And then women will also experience hot flashes, dizziness, headache, insomnia, and depression. Basically, a lot of the symptoms is more severe. Yeah. So when women do not have menstruation for 1 year, then the menopause is complete. Then this symptom will be less severe. Hormone replacement therapy has advantage and disadvantage. I'll briefly talk about this here. In the past, doctor prescribed estrogen to women after menopause, because after menopause, the decrease in estrogen level causes the decrease in the calcium absorption. Then it induces osteoporosis to many women after menopause. So doctors start to prescribe estrogen replacement therapy to women. Advantage, of course, is to slow down the osteoporosis, and also there's I would say a good side effect. It increase the libido of women, because high estrogen level causes a lubrication of the vagina. After menopause, when there's no estrogen produced by the ovaries, then what happened? The lubrication in the vagina decrease or even stop the lubrication. So whenever there's a sexual intercourse to women after menopause, it will be painful. The painful intercourse decreases the libido of women. So these two are the advantages: slow down the osteoporosis and increase the libido of menopausal women. Disadvantage is that high estrogen level in women increases the breast tissue density. So in this case, when women having a mammogram is basically X-ray to the breast, and then they will not be able to distinguish between the normal breast tissue and breast tumor. In the normal mammogram, the breast tissue looks kind of gray or dark, and the breast tumor is higher density, so it looks white. But after the estrogen replacement therapy, estrogen stimulate or increase the breast tissue density, then the breast tissue become relatively bright or white. So that masks the detection of the breast tumor, and that causes the increased death rate of women from breast cancer. That's the disadvantages. So contraceptive birth control method. There are lots of different birth control method. Only some birth control can reduce STD. As you know, that the condom, it helps to reduce the likelihood of STD. And as you know, you probably know that condom is not 100% bulletproof. Okay, even using condom is not 100% successful to prevent pregnancy and also to protect from STD. No, nothing is 100% except abstinence. Abstinence is 100% protection from STD and pregnancy. So all these are the contraceptive method. I will not go over every one of them. You can read about it yourself. either from this table or from the textbook. So some of it including morning after pill. So emergency contraception, meaning that okay, you have unprotected sex last night, then you take it as soon as after intercourse has occurred. You have two types. One is the prevent. It's called prevent. It's the progesterone pill. Basically, is to make the implantation difficult. Success rate is 85%. You don't need to know the success rate. Okay. And then RU486. Mifepristone. It blocks progesterone receptor in the uterus so that myometrium is locked off. So there's a plan B, non-prescription plan B. You have to take it within 72 hours. Approved by FDA. It is to delay ovulation if you take it before ovulation, or prevent fertilization if it is taken after implantation occurs. It is ineffective. So this plan B is also as soon as you have unprotected sex, then get plan B. There are different disorders of reproductive system. STD is a major one. You have viral infection, you have bacterial infection. Okay, AIDS or HIV is a viral infection. Genital herpes, human HPV, human papilloma virus, hepatitis B. All these are viral infection. They are difficult to treat. I'll say difficult or incurable. We can use for HIV. We can use cocktail drug to treat it. Those drugs, they are basically interrupting the protein synthesis process. It interrupts different stages, different steps in the protein synthesis. Bacterial infection, we mainly use antibiotics. Chlamydia, gonorrhea, syphilis, those are treated using antibiotics. But as you know that these bacteria, they are getting more and more resistant to antibiotics. So make sure you finish the bottle of antibiotics according to doctor's instruction. So AIDS is a pandemic prevalent around the world. In 2007, it already killed more than 2.5 million of people and infected 33 million people. The symptoms, basically flu-like symptoms. They have chills, fever, body ache, even swollen lymph. They are all flu-like symptoms. That's why it takes a doctor, experienced doctor, in order to tell the differences between is a flu, or are you getting a normal cold or flu, or are you getting AIDS? And then later on, okay, you basically don't have the immune system to fight for pneumonia, fungal infection, or other sarcoma. So, in other words, AIDS patients, they are killed by other infection, not AIDS itself. We use antiretroviral drugs. Antiretroviral drugs, they basically inhibit viral enzyme in the viral replication. Viral replication basically is a protein synthesis process. These antiretroviral drugs, they inhibit different stages in the protein synthesis. Usually they use at least 3 for the cocktail treatment. Well, they said that no vaccine, but actually people are developing the vaccine for this. People are developing a vaccine for this, for AIDS. I heard that there is some kind of success, but I'm not sure. But what I'm sure is that people are developing vaccine for AIDS, for sure. This is how HIV infect our body. So this picture is from your textbook. I strongly suggest you to read this part of the textbook if you really want to get to know more about HIV and AIDS. So at first, virus will attach to the receptor on the cell membrane. Usually this cell is the helper T cell. Helper T cell, the reason is that helper T cell, they have the CD4 receptor. On the surface of helper T cell, they have CD4 receptor on the surface. That's why helper T cell also known as a CD4 positive cell, because they have this CD4 receptor on the surface. HIV, this kind of human immunodeficiency virus, they recognize this CD4 receptor, and then they will bind to it. And as they bind to it, it will trigger something called receptor-mediated endocytosis. What it means is that the virus will enter the whole cell. And then the whole cell meaning the helper T cell, and then the virus contains RNA. We call it vRNA, viral RNA. V stands for viral. Viral RNA will go through the reverse transcription. Transcription, by definition, if you still remember the lecture earlier in this semester, transcription is the conversion of DNA into RNA or messenger RNA. Now, reverse transcription, meaning that we convert the viral RNA into cDNA. cDNA means C stands for complementary DNA. That is the DNA complementary to the viral RNA. And then the complementary DNA will become a double-stranded DNA. And then double-stranded DNA will be incorporated into the DNA in the nucleus of the helper T cell. The host is the helper T cell in our example here. And then since the viral DNA is incorporated into the DNA of the helper T cell, then it will go through the transcription translation normally. Then the more viral DNA will be synthesized to produce more viral protein. And after this, when you get enough viral RNA packed within the viral protein, that means you're making new virus. When you make a lot of new virus in the cytoplasm, then it will burst out, it will bud out, and then you make more. Basically, the HIV uses our body cell to make more of themselves. It's like a parasite. It's literally a parasite. So they make more of the viral HIV to infect more of the healthy cell. And that's why the so-called antiretrovirus drug, they are the protein inhibitor. They inhibit the different stages of this reverse transcription and protein synthesis. So the HIV virus, or we should just call it HIV because HIV stands for Human Immunodeficiency Virus. So what it says in here is meaning the Human Immunodeficiency Virus, which is not correct. Just call it HIV is fine. And then you can see that the structure of this well, I think the only thing you need to know is that the virus HIV has the viral RNA. That's the most important thing. The so-called GP120, the group 120, GP120, the docking glycoprotein, it binds to the CD4 receptor. The CD4 receptor on the cDNA. CD4 receptor on the helper T cell. On the helper T cell. And the virus contains a reverse transcriptase, so that once the virus go into the helper T cell by receptor-mediated endocytosis, then the reverse transcriptase can reverse transcribe the viral RNA into complementary DNA. Okay, let's talk about